Sinus infection is something that a lot of people suffer from, and we have worked with PCCA, Professional Compounding Centers of America, and they've come up with a way of treating sinus infections that I think is superior to anything that's been out there in the past. What we have is trying to follow the FDA USP guidelines, where it says that anything that goes into the sinus cavities needs to be sterile, so anything you mix or a pharmacy mixes needs to be used within 24 hours, so it doesn't have a chance of picking up other bacteria and causing more problems. And so what we've done, instead of dumping the drugs all into normal saline liter like we used to in the old days and squirt that up the nose, instead we've put the active ingredients into a little capsule, like this progesterone capsule, same size. And then we'll empty that capsule into either normal saline or sterile water, depending on which device we're using. And there's four basic ways to treat sinuses, and the basic one is what I like to say is X-Clear, or clear nasal spray. It has xylitol in it, and that you can buy for around 15 bucks over the counter. And that sprays up the nose and just gets in the frontal part of your sinuses. But the xylitol is a biofilm disruptor and antibiotic type medicine. So it's like washing your hands, you're washing your nose, keeps the bacteria and pollen from sticking around, and you can clear out your passages. You use it once a day, 12 times a day, and that's the great first step. But if it's more serious and deeper in, then the second thing would be to use a prescription of a nasal spray, where we add things like gentamicin, mupirocin, so antifungal, antibacteria, or steroid like budesonide, a biofilm disruptor like EDTA, 3 or 4 ingredients, and empty those into either sterile water in a 15 ml or into 100 ml normal saline, where we use a NeilMed device, fill it up 100 mils and squirt 50 mils up each nostril. That's the third best way. But the very best way is using the NasoNeb, where you have a nebulizer that's designed for the nose, and you empty the capsule into 15 mils of saline water and squirt that up. And if you're going to pursue this, I'd highly recommend that you Google YouTube for NasoNeb, N-A-S-O-N-E-B, and there'll be their company's 5-minute video, and then 2 of my colleagues, David Smith and Sherry Gavin. They have good video demonstrations of how to use these products.